특별히 EMTT를 추천할 만한 질환이나 경험적인 케이스가 있는지요?
In, say, soccer athletes, groin pain and symphysitis or osteitis pubis is a major problem and causing usually long absence from sport, usually half a year or even longer. And there have been 2-3 papers showing that shockwave might improve the healing of groin pain and symphysitis quite tremendously. And we started in Germany with a small trial with athletes with symphysitis and applied EMTT only for 6 sessions twice a week. And all patients had pain levels 7 or 8 out of 10 before. Then they received the EMTT treatments over 3 consecutive weeks. And the visual analog scale, the pain reduced quite tremendously to lower than 1 after 6 weeks. So in these symphysitis or osteitis pubis patients where MRI showed a bone edema, EMTT alone was very strong, and every other, say, therapeutic options, injections, very painful, very risky, operation usually not helpful in this area, and the return to play usually very long. So in these special cohort, athletes with symphysitis, EMTT makes a real difference in my view.
EMTT가 고강도 자기장 치료이니 특별히 금하거나 주의해야 할 상황이 있는지요? 요즘 치과 임플란트나 골절로 인한 금속판 고정을 한 경우가 많은데 이런 경우 어떤 주의를 해야 하고 고강도 자기장으로 인한 신체 내부 화상 염려 같은 것은 없는지요?
This is a very important question because we always consider technologies with regards to safety. And one contraindication is if you apply EMTT in a patient with a pacemaker or a defibrillator, when you want to treat it nearby the device. So usually, and I started my career as cardiac surgeon, so I implanted some 600 pacemakers. So usually they are left side here. And if you have a left shoulder problem, for example, I would not recommend to use EMTT because the electric field, the oscillating magnetic field, might disturb the pacemaker or the defibrillator if it's within 20 centimeters of range. So if you have a heel spur or a tendon problem and you are a pacemaker, there is a lot of distance, but pacemakers nearby the device, caution, not recommended. Second is implants. There are a number of studies underlying the myth that implants might heat up due to magnetic fields, even in MRIs. So I found a very nice experimental study, and they put every available implant, hip implants, plates, screws, in the 3 Tesla MRI and measured the surface temperature of the metals and found no real changes. So it appears to be kind of a myth. So in the moment, if the implant for whatever region is MRI safe, then you can use the EMTT as well. If it comes to implants, my friend Ludger Gerdesmeyer from Kiel, Germany, is performing knee and hip prosthesis. And he is applying EMTT and shockwaves immediately after the implant to accelerate the implant healing into the bone. So not loosening, but even accelerating the healing. I myself will receive 2 dental implants in May in Austria. So I'm pre-treating myself and will post-condition myself with the EMTT with my implant as well to have more bone stock. So this is a very important thing. We discussed on 2 other issues, minor issues on EMTT. The one is tattoo. So there are case reports, 2-3 case reports of patients who were inked or tattooed, undergoing MRI and 3 Tesla MRI, and they reported some heating in their ink. And this was because some of the ink was ferromagnetic, and the strong magnetic field could heat up the ink. And due to this observation in MRI, we are cautious if you do EMTT directly over a tattoo. And I apply the EMTT with a lower energy and stay with the patient while elevating the energy to level 8, for example. And if there is no heating within 10 seconds, which the patient feels, there is no risk, so one can proceed. The last thing to consider is contraception or contraceptive with a coil, with copper coil. And copper coils might have some metallic, let's say, components. And if, for example, females with a contraceptive of copper undergo an MRI in a 3 Tesla MRI, there might be some dislocation of the copper coil, and therefore maybe an unwarranted pregnancy might occur. So I would recommend, if, for example, you want to treat or to offer EMTT in a female using these type of contraceptives in the pelvic area for pelvic pain for whatever reason, at least to acknowledge that there might be the risk of a dislocation of the coil. This is, in the moment, an informed consent. We do not have any data on this, but these are the precautions we have in the moment. And all implants which have some electrical components, say cochlear implant, insulin pumps, spinal pacemakers or so ever, are contraindications for the EMTT because the electronics might be harmed by the electric field.